Imagine a world where scientific breakthroughs ignite hope, where the boundaries of human potential are pushed beyond imagination. I know, we're in that world. My name is Favor Abimifulwa Ishola, and I stand on the precipice of shaping the future of healthcare through harnessing the power of gene editing and stem cells to promote tissue regeneration and repair. I present to you Orgeneration, engineered stem cell-based therapy. I will be sharing with you the convergence of cutting-edge technologies, fusing synthetic biology, gene editing, and regenerative medicine into a single transformative entity. Orgeneration is not a drug per se, but rather a therapeutic platform that corrects genetic abnormalities and creates patient-specific modifications based on their unique genetic profile. This prospective treatment holds the promise of overcoming the limitations of traditional treatments by unlocking the regenerative potential within our own cells. To achieve efficient and precise gene modifications, there have been extensive focus and research on gene editing tools, particularly the CRISPR-Cas9 system. Specifically, the refinement of the CRISPR-Cas9 system is focused on improving its accuracy and specificity in targeting certain genes within our own cells by fine-tuning the guide RNA and other delivery mechanisms to significantly reduce off-target effects, so it is ensured that the genetic modifications are precisely directed to the intended genes. Then, the quest to engineer stem cells with regenerative properties starts, and specific genes like the chromosomal and multifactorial genes are targeted because they are associated with stem cell proliferation, differentiation, and tissue integration. Cells' ability to proliferate are then enhanced, and this allows for a greater supply of cells for tissue repair that guides their differentiation into specialized cell lineages, which are required for targeted tissue regenerations, such as the neurons, the cardiomyocytes, and the chondrocytes. But this depends on the tissue that needs repair. Taking personalized medicine into account, the concept of Orgeneration is integrated in such a way that specific strategies are tailored for each person's unique genetic profile. But the question is, how will this platform be created and administered? First, we have the preparatory phase, where before any therapy can be administered, a patient-specific approach is followed. This includes collecting relevant medical information, including the patient's medical history, genetic profile, and most importantly, the specific condition to be treated. The patient's own stem cells are then collected through a minimally invasive procedure, such as the bone marrow aspiration or the peripheral blood collection. Then, we have the laboratory processing phase. In the laboratory, the collected stem cells go through a series of processes to enhance their regenerative properties. Then, the specific genetic modification, which is dependent on the specific genetic condition, is introduced, and it differentiates into the desired cell type, integrating it with the targeted tissue. Afterwards, the specialized cell differentiation are carefully monitored and controlled to ensure the desired cell types are generated, and this phase is called the differentiation and expansion phase. The stem cells may be expanded in the laboratory to allow a sufficient number of cells for transplantation. For example, if the therapy aims to treat Parkinson's disease, then the stem cell may be induced to differentiate into dopamine-producing neurons. Finally, we are at the administration phase, and here the engineered stem cells have been prepared and will be administered to the patient. But it is very important to note that the route of administration depends on the targeted tissue or organ. For example, in cases such as neurodegenerative disorders, the stem cells may be transported directly to the affected area of the brain through surgical procedures, but in other cases such as musculoskeletal injuries, the stem cells may be transported directly or injected directly to the affected tissue or joint. After this, one thing that is important is post-treatment monitoring and follow-up. These are extremely crucial, and as a result, medical professionals will closely monitor the patient's progress, evaluating factors such as tissue regeneration, integration of the transplanted cells, and improvements in symptoms. Regular checkups, imaging studies, and functional assessments will be constantly carried out to assess the effectiveness of the therapy and make necessary adjustments to the treatment plan. A scenario that Orgeneration therapy would work for would be that you imagine a patient named Sarah who has been diagnosed with Parkinson's disease, a neurodegenerative disorder that affects her motor functions and quality of life. Bear in mind that after receiving conventional treatment, Sarah's symptoms continue to progress, limiting her daily activities and causing her significant distress. A potential solution that Orgeneration would offer would be that Sarah's stem cells would be isolated for personalized treatment, and with the refined CRISPR-Cas9 system, the specific genes involved in dopamine production, dopamine receptor 1 to 5, DRD1 to DRD5, COMTL, catechol or methyltransferase, and dopamine beta hydroxylase, would be modified into the stem cells and would enhance the stem cells' ability to differentiate into dopamine producing neurons in order to alleviate the symptoms of the Parkinson's disease. Once the stem cells have been modified and carefully differentiated into dopamine producing neurons in the laboratory, the specialized cell that are already enriched in dopamine would then integrate with the existing neural network and restore deleted dopamine levels. Over time, as the transplanted dopamine-producing neurons start to integrate and function properly, Sarah's motor function would improve and she would experience a reduction in tremors, improved muscle control, and an overall enhancement in her quality of life. What makes Orgeneration particularly beneficial is its personalized medical approach, reducing the risk of rejection and increasing the likelihood of successful genetic outcomes. Please note that Orgeneration is focused on specific treatments for specific conditions to make it more effective and targeted. Orgeneration holds great promise in transforming the treatment landscape for a variety of medical conditions, offering hope for patients like Sarah who are in need of regenerative therapies. Thank you very much for listening. My name is Favor once again. Orgeneration is a combination of organ and regeneration. Bye bye.